Here we are. Thank you so much. So my name is Robert Röppling. I'm a medical director at UCB, and I will talk about Staccato alprazolam, a drug-device combination. This is the device. I'm sure you can see it here somewhere on screen, which we're developing as a novel seizure rescue medication. In line with previous presenters, I have to say it's not yet approved or available anywhere, and all people who have worked on these slides are full-time employees by UCB. The actual device is produced by Alexa Pharmaceuticals, a company actually set up in California, and we're using a model of the device, which is a single-use, single-dose delivery system. A few years ago, a small company, Engage Therapeutic, was set up to explore whether this device-drug combination can be used as a seizure rescue medication, and they conducted a phase 2 study in 2019. And based on the promising results of this study, UCB acquired Engage in 2020. And since then, we are developing Staccato alprazolam. And we're happy to announce that we have started phase 3 in December last year. Next slide, please. The device has been shown in this meeting previously, but I'll show it again for some people who may have not seen it before. It's an inhaler, but different from typical asthma devices. You'll not find a button on it that would sort of make the drug eject. Instead, there is a sensor built into the device, essentially at the rear end of the device. And this sensor, an airflow sensor, waits until enough air flows through the device, and only then it will trigger a reaction. So a breath from the patient will trigger the device, and the same breath then will also deliver the drug vaporized by a heat reaction into the lung, and then finally the bloodstream and the brain. The device can be used by both patients or caregivers, and it has been successfully administered by caregivers in patients during a seizure with impaired awareness. Next slide. As mentioned before, Engage has conducted the phase 2b study in 2019. Since then, we have conducted 3 phase 1 studies. One ethnic PK study to allow inclusion of East Asians in the program, a study in adolescents to allow adolescents in the program, and a study in patients with asthma to assess pulmonary safety of this device. And we're currently in discussions to open up the study to that population in the next time. The main program is a double-blind, randomized, placebo-controlled phase 3 study and a open-label study that accompanies it. Next slide, please. The main study has a co-primary endpoint consisting of seizure termination within 90 seconds of drug administration, as well as no recurrence of seizures within 2 hours after drug administration. There are further secondary endpoints, including further time points of no seizure recurrence, including 4, 6, and 24 hours. And then there's a range of different outcomes. Essentially, we're trying to assess seizure severity or reduction of seizure severity by looking at seizure-related falls, injuries, tongue bites, and whether or not a seizure has progressed to generalized or bilateral tonic-clonic seizure or even status. Next slide, please. Here are the main study periods. Patients can enter the study if they've had 4 or more prolonged seizures in the last 6 months before the study. A prolonged seizure defined as a seizure lasting 3 minutes or more, roughly. And once they're in this screening, we have agreed with the Epilepsy Study Consortium that they kindly review the data from all patients on consistency of seizure classification. But the main challenge is to find patients and caregivers where the caregiver can recognize that a currently ongoing seizure is a prolonged seizure and will most likely last another 3 minutes or more. And that is the time that we want to shorten with our drug compared to placebo. So once the patient is approved, he or she goes through training and protocol training and device training, and is then randomized 1-to-1 to receive either Staccato placebo or Staccato alprazolam. And then is essentially sent home because this study happens at home, where we are waiting for just one seizure to be treated, either Staccato alprazolam or placebo. Once that is done and achieved, the patient can return to the clinic and then go on to the open label study. Next slide, please. This is the key device, or actually the full IMP kit for the study. You see here on the screen the little blue arrows, and the lower arrow points to the foil in which the actual treatment device is located. So that's of course coming first. Once the drug has been successfully administered, which is indicated on this device by a green light turning off, the caregiver has to be present and use the timer device to start timing then, and then measure the time until the cessation of the seizure. So this device, you can see in the middle here, there's the paper tap to activate it, then a button press to indicate the stopping of the seizure. That contains the raw data of the primary endpoint of the main study. And this is happening at home and has to be collected by the caregiver. And we are aware of this is putting a bit of burden and pressure on the caregiver and his or her ability to conduct this measurement during the acute scene of a seizure ongoing. And that's already it. In conclusion, Staccato alprazolam is a breath-actuated inhaler under investigation as a potential seizure rescue medication. We have happily started phase 3 in December last year. The study has begun in the US and in Japan, and we are planning to include the EU and China this year. And we are planning to enroll about 200 patients with one evaluable treated seizure according to plan. With that, I thank you for your attention, and I'm open to questions.